If you see, it's the pain. Okay, first thing. Second will be stiffness, and that's more in the morning hours basically. So that is the main working time for the ladies, because most of the patients, 4 out of 5 would be females. And morning, you know how it is difficult because too many household works to carry on, and the maximum stiffness is in the morning hours. So some take more than an hour to get free, some take even 2-3 hours to get relief with the pains and the stiffness. So that is one difficult thing. And the first thing we ask them is कि आटा बांध सकते हो क्या, रोटी बना सकते हो क्या? So that's a big question. And those who come from the rural areas, उनके लिए रहता है कि गाय का दूध नहीं निकाल पाते. So that's a big issue with them, because they just want to be able to do that.
Yes.
So that is one big thing. Other thing we face is here in India कि नीचे बैठना है. With the knee issue, they are not able to sit on the floor or sit cross-legged. So other question they ask us is कि हम नीचे बैठ पाएंगे कि नहीं, या कब बैठ पाएंगे. That is a very common problem with them. So driving and using the computer and all, वो सब तो ठीक है, मतलब depends on the profession if they are using it too very often or if into that particular line. But जो common ladies में जो problem होता है, initial morning household work, rural areas में again the household work and the managing the cattle and all, and sitting on the floor. So these are 3 main things that immediately comes into my mind. And in males, it is basically driving, because they feel that sometimes their back gets stiff. Who are working in the fields, so they have this problem of doing all the field work also. Okay, and others who are into factories and all, sometimes they have to wear those safety shoes.
Yes.
So those safety shoes are very heavy, and at times they are very stiff. So that leads to a lot of ankle and knee pain also, precipitating to that. And others is like, in males it is basically the back pain related arthritis. In females it is the small joints more commonly. So that back pain thing, so they have difficulty in working on the computers for long hours, because that's their job mostly nowadays, no? Even driving becomes difficult, as I said, so that is another thing. Sometimes they have a very disturbed sleep, all of them, male, female, whatever, because of the pain and all. Even turning in the bed at times will cause a lot of pain, and they have to wake up actually. So that is a big problem. So not getting a proper sleep is an issue. And because of all this, they have maybe impaired dietary habits because of medicines or whatever. They are not able to take food properly. So they land up with a lot of deficiencies and weakness. And sometimes, just now this patient came, so he was saying like, evening mein every day I get fever or feverish feeling as such. So this is very common symptoms that we come across. This is for the common arthritis, and there are other rare arthritis wherein lungs, kidney, heart also get involved. So they are very few percentage of patients, so they have their own set of different issues. So somehow I have this habit of talking to females and asking them. So very common, especially those who are young, and sometimes even unmarried, they have the family issues of how to get them married, whether to tell the other family about the disease or not, because it's going to stay. So that's a very big social issue. I've seen a lot of females actually getting separated and divorced because of the disease itself. So that's a big trauma for the family, for the patient altogether. Then there are certain issues when they have planning to conceive. So there are certain medicines which we give for arthritis. So with those medicines, we ask them not to conceive as long as they are on those medicines. And when they actually plan to conceive, we have to take them off those medicines, put them on a lighter medicine. That may aggravate their pains, but anyway, we have to help them sort it out. So somehow they have to balance their life with this. So it's a big mental trauma for them as well. And family support is really very important, which I would say is 60-40. I've seen 60% patients actually supporting, get the support from their family members, but then there are other set of patients who don't get any support from their family. So that's a big issue. So that leads to a lot of anxiety, depression, disturbed sleep. So we have another diagnosis what we call as a fibromyalgia. So this is non-specific aches and pains. Okay, so there would be set of patients whom we are treating for rheumatoid probably. We are seeing good results in the reports, but still the patient doesn't seem to be improving at times. She keeps on complaining, मुझे यहाँ दुख रहा है, मुझे वहाँ दुख रहा है. So that sort of patient, then we have to look for a secondary fibromyalgia. So that's basically their emotions are so high that their body actually gets too sensitive. Okay, so even a small thing happening in their life, they will aggravate it to a big level. So that leads to all these aches and pains things. So then we have to put them on some other set of medicines also to calm them down. That is another big issue. So emotional issue definitely is there. And sometimes, in fact, most of the time, patients getting rheumatoid or any other autoimmune disorder, the trigger is a stress. It's either a physical stress or a mental stress. So I've seen again a lot of ladies who have either some family issues already they had with their in-laws or sister-in-law or whatever, even with their husbands at times. There are ladies who have kids with special needs. So while taking care of them, they actually don't take care of themselves and they'll end up getting this arthritis and all. So a lot of things coming out when we actually talk to them, what might have triggered it. So some or the other issues will be there, and they are either a type A personality. Otherwise, if nothing is there, then it is a type A personality. Certain medicines, they can cause deformities in the kids. Okay, unborn kids, it's like जैसे Hrithik Roshan का extra finger है, or they may have a cut in the lips, or the ears may not be developed properly. So this kind of physical deformities may be associated with kids born to patients who have been taking one of these drugs. There's this lady, she's put anything in the status. Just when she had delivered the baby, maybe just 2-3 months after her delivery, and she started having symptoms of something, not rheumatoid, but it is a more serious disease, the lupus. Okay, and she had protein which was leaking from the kidney, and she had arthritis, she had joint skin problems and multiple things going on. So we gave her all the best possible medicine, but somehow she was not responding, and we had to put her on high dose of steroids that time, and she had to stop breastfeeding because of we had no choice but to give her those medicines. So somehow she started responding, and she was we have given her almost like first, second, third line therapy, all the possible therapies, and she did not respond. And then we thought of something out of the box, which is not the usual path of treatment mentioned anywhere in the literature. So I just tried out that particular medicine for her, and somehow that clicked for her, and she was doing well. Then what happened came the COVID part, and during COVID she did get COVID, but there was no symptoms of COVID. She was just COVID positive, and I had an online video consultation also with her during that time, and she was doing fine. But then post-COVID, she again started developing symptoms of lupus. So COVID was a trigger, although COVID did not affect her during that time. But post-COVID, after she recovered, her lupus symptoms came up again. And again her BP started rising, 200 by 110 or something like that. And she was on at least 8 antihypertensives in a day. So, and again the same thing, no other medicine was working, same thing, same doses. And the bad part was the medicine that I was giving, sometimes that also causes hypertension. So I could not increase the dose also for that medicine. So again there was inflammation in the kidney, and there was no other way to actually manage that. So that was a challenging case. So somehow with the help of a nephrologist, and she had a good family support, we could actually control her hypertension. Now she's come down to maybe still 4-5 medicines for her hypertension she's taking, but kidney inflammation has gone down, BP is now under control, all other symptoms are well taken care of. But it took post-COVID 1.5 years to give her this type of recovery. But what I see is she is always smiling, very, very enthusiastic. She never looks depressed, and probably it's the family support and that is working for her. So that is, she is brave girl, I would say. In fact, principal investigator for a lot of new drug trials also.
Wow.
So I started this drug trial maybe 14-15 years back, the first trial that I did, and that drug is now in the market.
Wow.
So initially it was patented with a big multinational company, and now that patent has expired, so it is now available as generic molecules also. So that is helping a lot of patients. And that is just the first drug that I had done. After that, I've done a lot of other trials. So this field is coming up in a big way with the new medicines, new treatments. So, and it's basically what we call it as now treat to target.
Okay.
So we have come down to the level where we can identify the simple chemicals which are causing the inflammation. So we have ways to block those chemicals and bring down the inflammation. So that is work, and these are basically antibody mediated. So there were injections also which are actually blocking those antibodies. So this is what is called as the treat to target regime. This is very, very important because medicines will work to a certain extent only, maybe like 70-75%. The rest of the things, to make it 100%, it is the diet, the lifestyle which works in a big way. So if you are like taking medicines but you're not moving around, nothing is going to happen unless you move around. So suppose you have a finger stiffness in the morning, unless you try to move your fingers, you're not going to feel free. So it's important actually to get out of the bed and start doing your activities in spite of the pain. This is one particular arthritis which actually improves with activity. There are other pains which improve, actually deteriorate with doing activity. But arthritis is something where activity will improve your pain and stiffness. Suppose in the morning, if patients are feeling stiff while just brushing their teeth, if they for 5 minutes they can put your hands in the warm water, they'll start feeling better within just those 5 minutes, and they can go about and do their work. So that is really important, to keep on moving. That is important. Creating an awareness for arthritis is really very important, because what we have come across very common, people don't understand what the word rheumatology actually means. The first problem is there. For any bone and joint problems, they first go to an orthopedician, which actually is not the domain of orthopedician. Orthopedicians are the ones who actually do surgery if you have got a fracture or some injury or some replacement is required. Otherwise, all the arthritis and all the autoimmune diseases are come into the domain of the rheumatologist only. And first thing is creating awareness about what rheumatological disorders are, one thing. And then once you know that this is a particular disorder, what is important is to get a diagnosis. There was a study wherein it was suggested that the median delay from the onset of symptom to the diagnosis, even not just in India, even in the Western countries, it is 7 years. So patients keep on moving around from door to different doctors. They come with 10-20 files with us and they don't have a diagnosis. That is a very, very big issue, and by 7 years so much of damage has already happened. And here in India we have to compete even with the Ayurvedic and the Unani and the homeopathy people also, because people have more faith in them. So to get the diagnosis itself is a big issue, and once the diagnosis is done, then the challenge is continuing on the medicine. So just to advise to them that you take these medicines, and that way the doctor is just giving the medicine, but that counseling part is also very important, that you have to take these medicines for long. Otherwise these patients will stop taking medicines, or they'll be just fed up of taking that medicine. So it is our work also to keep motivating them that they have to take a continuous treatment. It's just like a diabetes or hypertension. Once you have it, there's no cure to it. You can control it. Same with this arthritis. You can control it. You cannot cure it. That's why that creating awareness for diagnosis and then creating awareness to continue the treatment, that is also very important. Then the third point comes looking for the side effects for the medicines. So sometimes what happens is we write 4 medicines, patients will take the 2 medicines out of it, 2 they will leave, and those 2 medicines will be either painkiller or steroid, which we actually want to stop. The main medicines they will skip, and the other ones which we are giving only for a short period of time, they will continue to take it. So we have to educate them about the type of medicine also we are giving. And then we ask them to do regular tests also. Just like you get your sugar and the high BP, patients will get their BP checked. So there are set of tests we do for arthritis also, just to monitor the side effects for the medicines. So those testing is also very important on a regular basis. That is also to keep in view, like a lot of patients will land up with other complications, because the rheumatoid patients have more chances of getting a heart disease. The young patients will get a heart attack. They will have a lesser immunity. They will have more chances of getting infections. So keeping all those things in mind, to keep a balance with their immunity, keep a balance with their joint pains. So managing the disease itself is like a win-win situation. So you have to weigh the effects and the side effects of the medicines, and we have to balance. We have to find a middle path. Actually, clinical therapist and all, वो सब ठीक है. That is good for the urban part को मैं समझती हूँ. But rural areas में ये problem है ही नहीं. They don't understand what is depression, what is anxiety. ये words सब urban words हैं and Gen Z words हैं, I would say. ठीक है, हमारे मम्मी पापा हमको कुछ बोलते हैं कि ये करना है तो करना है. We don't argue, we don't say yes or no. करना है तो करना है. We also do it. क्यों करना है, कैसे करना है. Nowadays we have to answer our kids कि भाई क्यों करना है. We have to give an explanation. We have to give them a logic why you want to do it and why it should be done and all those things. वहाँ पे still it is the way we were brought up. तो जो है वो है. And actually they are very good patients. उनको जो हम लिख के देते हैं ना, they follow it very religiously. They don't mess up with the medicines. Urban में ही होता है कि they do all this Google search and all, and then they come up with so many doubts कि ये भी है, ये तो नहीं होगा, वो तो नहीं होगा. जिसको नहीं मालूम है ना, half knowledge is actually more dangerous. जिसको नहीं मालूम है वो हम पे पूरा faith रख के they will follow everything. So that is not an issue. Rheumatologists in India, actually full-time working rheumatologists will be very less, maybe 1200 or something. And orthos, if you see, there would be 1200 orthos in Ahmedabad. So leave apart the India part thing. So we have to reach out to the government. So our voice is yet to reach there. So unless, and if it is actually a doctor-driven thing, no, it is listened less often. If it's something coming from the patient, from the general public, then probably government will lend ears for that faster. So that patient initiative has to be there. So we are trying to motivate, but let's see, because it's coming just from a small set of patients, maybe it is not working out. So if it comes from a pan-India thing, probably some things might get better. The Ratlam, MP से आ रहे थे ट्रेन में. So while they were getting down, वो हम बोले हम तो कहीं और जा रहे थे, वहाँ पे सामने कोई और बैठा होगा. बोले आप डॉक्टर रीना शर्मा के वहाँ चले जाना. तो जस्ट ट्रेन में उनकी बात हुई को पैसेंजर से, and then they came here. So it's more of word of mouth, और थोड़ा अभी गूगल सर्च, थोड़ा रूमेटोलॉजी जो वर्ड अब जो स्प्रेड हो रहा है ना, तो गूगल. आज जैसे एक और पेशेंट आया, वो लिविंग इन द साउथ भोपाल. तो पहले किसी औरतों को दिखाया होगा जो भी है, and they're not convinced. तो then they searched for good arthritis doctor, और तो वो rheumatology word आया. फिर rheumatologist क्या होता है वो सर्च किया, फिर वहाँ से rheumatologist in Ahmedabad सर्च किया. So that way kept on getting. तो educated में तो वो होता है, and rural areas में it's word of mouth basically. Or else if we do some campaign or we do some camps, then that awareness comes. And sometimes it is more important actually to teach the doctors in the rural areas, the GPs, the family physicians and all that. So if we create an awareness with them, they will refer the patients. That is also a way by which we can spread the awareness.
So like patients are like directly not aware of this needs to
No. Right now no. अभी तो एक भी चेस्ट पेन है तो कार्डियोलॉजिस्ट के पास जाना है ना, हेडेक हो रहा है तो न्यूरोलॉजिस्ट के पास पहुंच जाएंगे, या स्ट्रोक आया तो न्यूरोलॉजिस्ट के पास पहुंच जाएंगे. अभी स्टिल rheumatology is in the very nascent stage.